An effortful swallow is a strategy that is utilized in speech pathology world to help move liquid and food through the throat. It also can help with strengthening the muscles of the swallowing on the posterior pharyngeal wall. Those muscles are often impacted during the treatment of head and neck cancer. An effortful swallow is guided by your speech pathologist based on a certain consistency. Your speech pathologist may have performed a swallow study on you, and that swallow study will help to determine the safest consistency to start with. So, at our clinic, we're going to pretend that I was the patient. I have gone through treatment. Now I am about 3 months following my treatment. I am desperate to start eating and drinking again. My speech pathologist has just performed a swallowing study. Certain things are easier to swallow than others. So for me, what my speech pathologist recommended was let's try some pudding. My speech pathologist recommended 5 cc's of pudding. She wants me to go ahead, place this inside my mouth. I happen to be my speech pathologist also, and think swallow hard. So in my mouth it goes, lips closed, swallowing hard all the way from the lips, all the way down through the throat. Okay, I'm gonna do that again, and we're gonna do it from the side. I place it in. I ensure that it feels as if it's cleared and it's gone down. Now, you'll notice I'm a messy pudding eater. So let's try that again and see if I can get all that pudding in my mouth. A couple of things that are important to know. After radiation therapy, our patients lose some of their feeling inside their throat. They may think that the food is moving safely through their throat, but in fact, the cranial nerves have been involved in either the disease at the primary site or in the radiation field during treatment. If a patient loses sensation or feeling in the throat, the swallowing can be altered and be unsafe. It is very important in our world that we look at this objectively with a fibroendoscopic swallowing study or a modified barium swallow study to help our patients decide how they're going to progress forward. So we're going to do this again, and most commonly in head and neck cancer following treatment, not all consistencies are swallowed in one swallow. They are often swallowed 2, 3, 4, 5 times. The patient who swallows 5 times has a rather inefficient swallow. They will benefit from therapy and guidance in how to improve those muscles. The patient who swallows 2 times may also have an inefficient swallow, but after their swallowing study, they can determine is 2 swallows enough to clear what's in the throat. So I'm thinking I'm squeezing, swallowing hard, all the way to the lips. The back of my tongue is pulling back hard, sending the food down the throat. The throat is working very, very hard, and the esophagus is wanting to open up. The esophagus opens when these muscles say, hey, something's in the back of my throat. I want you to swallow. Those muscles are called the suprahyoids. Those suprahyoid muscles have a sensory response when they feel food coming over the back of the tongue. The brain tells us, swallow. They elevate, move forward, and then they pull open the esophagus while at the same time closing off our airway and sending food down. So let's do that again. We're gonna take a bite and we're gonna think swallow hard. I'm squeezing and swallowing as the food goes down. As with all of our exercises, we want you to have a trusted speech pathologist and therapist to guide you, but we hope this is helpful.